think it then is time for our kind of last big activity that we got for you guys, and it's a little bit more of an interactive session. So we're doing something that's been done before in the TIS kind of workshops environment, but done in a face-to-face environment. We're hoping to still be able to do this. So this is using a tool called Mentimeter. I think if some of you may recall, was used by Steve Fisher in a few years ago with the TIS workshop. So we might kick that off. So what this involves is you guys using either your smartphone device, so you're logging into a web address and providing a code that joins you into what we're going to do is a shared poll. I'll just bring that up on the screen with the details that you guys need to utilize. So this can be done from your laptop as well. So there is the code that we need you guys to use. So on your phone internet browser or your laptop internet browser, we need you to put into that address, and you'll be asked to enter in a code. And that's the code that you need up there on the screen. So that will bring you all into this shared space of a live poll. And what the activity that we're doing is around identifying key priorities. Now you'll notice you get some numbers pop up here. So as we go through each of the slide screens for this poll, you'll see the number of respondents that we have, and also you'll see the responses that people are giving live on the screen to each of the slides and the questions. So we might kick off with the activity. If everyone can give me a thumbs up that they've got access to that website, either from their phone or smartphone device. Yeah. Okay, so this is all about using strengths to overcome the challenges that we have in the program, and a lot of these challenges and a lot of the strengths that teams are using has come out over the session. But what we have created here is a look at some of the stuff that has come out of previous workshops. So the national workshop that we had back in Alice Springs in 2019, and various forms of surveys that we've kind of gotten feedback from teams. So I see quite a few have joined it. So we might kick off around the first slide there. And what we're asking there is, how would you rank these community cultural challenges? So this is out of the session that we did on remote and very remote. And as you can see, people are responding there. We've got one respondent so far. So as you guys are responding, you're seeing that these priorities are being, or people are ranking out where they see that these community and cultural challenges are things that are impacts on the program. So applying population health promotion approaches in a remote setting, quite popular there so far. Smoking not being high up in the priority list locally. So I'll give a little bit of time for people to respond, but I think as we move through these, you'll see the kind of ranking emerging, the things that are emerging are quite common threads that we're seeing through the conversations and things that teams have mentioned either yesterday or through the concurrent breakout sessions that we had today. So I think that might be about it. We've got 20 respondents now, got a few more. I'll give it another 10 seconds for people to respond before we move on to the next kind of challenge that has an area. So when we look at challenges, we looked at these that were identified from the remote and very remote sessions in the Alice Springs workshop, and these are thought up as system challenges. So things like lack of appropriate clinical services for referrals, so referrals from the TIS team into that clinical space, developing effective partnerships, adapting elements of the TIS program, so the quick skills and a quick line, and looking at the priority groups around working in that remote space. And by all means, Penny, jump in with any feedback on this. I mean, these kind of challenge areas that we've identified.
Yeah, I'd say, Ben, there's no surprises so far in the way people are ranking things. But it'd be interesting, I think, at some point to get some feedback on whether any of these challenges in any of the categories we've come up with are starting to drop off the list, whether they're still relevant now.
Yeah, this is almost 2 years ago that these were identified in that national workshop, and they seem as relevant now as I guess they did during those sessions from the teams. I might move on from that one if everyone has had the opportunity to respond. So the kind of training and workforce challenges, so common things that came out for teams during that workshop around those very remote sessions. As a project officer with NBPU, they're quite still common, I think. I think now we kind of come into an area with the next slide that we'll have where a little bit more complex. So we're kind of asking you guys, are there any other challenges to add to the list? So give it 5 more seconds. So this question is not quite ranking, it is, have we missed any of the challenges that are there now that weren't there before? As I said, these things have come out of the workshop session, previous workshop sessions that we've had with the TIS teams. Okay, so I'll move on to the next one. So what challenges would you add to the list for remote service delivery that haven't been captured or ranked before from those 3 category areas? And this is a free text, so feel free to type in the kind of challenges that you'd like to add to the list that we haven't captured already.
And I'm pretty sure no one can be identified from this, can they, Ben?
No.
All anonymous.
It's purely anonymous.
Yep.
we have our first one, social determinants of health. Unable to travel. Recruitment and retention of community-based staff. Time spent in remote areas. Making smoking a community problem and not just a health problem. Lack of health literacy. Access to clinical support and NRT. So all of these we're going to be able to provide back from this exercise in a report that we'll share on the website, so you'll have access to these and can use them within your own organisations and planning. Again, time spent out in remote communities, not enough for our team to provide adequate face-to-face education and support. So is it that feeling of fly in, fly out, especially remote communities where the resources are not there for you to spend multiple days, I guess, is always an issue. The lack of cultural male-female balance. So again, around the recruitment and retention, so having an FTE in the team that is commensurate with the kind of community and engagement in your program. So having the right makeup in your team. Not enough time, again. The ability to spend more time in an urban area than in the remote areas that we service. So a few there, environmental and kind of relating to partnerships with organisations within those communities. Best practice resources, templates. Resistant communities, so not wanting to address smoking or to even talk about smoking. Transient population. Is that organisations controlling TIS activities and funding. Access to NRT again. Cultural impacts can impact on the delivery of funerals, sorry business, men's business. Relocation of key staff, fragmentation, limited resource relationships. So quite a few common themes coming out there.
Mm-hmm. Yeah, again, I think, Ben, this is somewhere where we can do that sort of thematic analysis and put everything together for sure.
Yeah. I guess we can go through these. I think that more and more are coming in. I guess where we wanted to go with this, with you guys adding to the list, and is also to get you guys to do an exercise of ranking those again. So the challenges that we didn't include. So we're identifying the greater priorities in those for remote service delivery. And I think we're ready to go to the next slide, Scott. Is that okay? Yep. Okay, just a few more before we go. Obviously, cost and expense around that delivery and terms of, I think it's not, I know where this one comes from, but yeah, the different costs for providing the different services, whether that's a budget or funding issue, and in terms of consideration of the additional costs that are present there for teams who have greater complexity to their program. Yeah, again, budget restraints. Okay, I might move on to the next part of that poll, which is now taking those areas and themes, and we've got a few there, not all, but these are kind of grouping those things together and just looking at you guys kind of ranking these from the additional list that you guys just identified. No responses yet, or is it broken? No.
There you go.
There we go. Okay, then quite a few and yeah, similar themes to those identified earlier, but more in depth, I guess. Community-based staff, retention, balance of male and female, quite strong, and yeah, smoking a community problem. Okay. Like I said, these are quite a few to group together from the last slide. I think more than we envisaged. So again, grateful for the contribution from you guys. And this is yeah, stuff that seems to come through quite commonly. So with the next poll and slide. It is around kind of getting you guys to look at what extent do you agree with these strengths are important in overcoming some of those challenges of TIS in those remote areas. So have a read through those, and this is a sliding scale. So you'll see the markers on each of the scales where you can slide the marker across to how strongly you agree or how strongly you disagree with those statements. Okay, I think most have voted on this one, and I think there's strong agreements there with those statements and the strengths that we've identified there. I'm just mindful the time, and certain teams are it's their lunch break, and we need to wrap up soon. So I might progress to the next slide if everyone's okay with that. So again, this is one where we want you guys to let us know what kind of strengths do you guys have in those remote areas which you'd add to this list. So thinking about the statements that we had in the previous slide, what else would you add that are the strengths that you guys have within your programs, or that you think are beneficial to service delivery in remote areas? So adaptability, flexibility. Is it that kind of adaptability where things can go wrong, things might go wrong, whether impacting on your ability to deliver? So messaging being in language, so looking at stakeholder collaborations around developing the messaging in language in those remote areas. Connection to community, quite a strength there for teams to have that connection in those communities. Genuine mutual relationships that are long lasting between non-Indigenous and Indigenous staff and community as well. So it's being recognised for health matters in that region. Having an innovative team is quite important. Cultural sensitivity, cultural knowledge and local relationships. Those relationships with role models. Really to pivot quickly, take advantage of every opportunity around that community engagement. In-depth knowledge of culture and community protocols and practices. So culture coming quite strongly in those strengths. So around relationships, around identifying local role models. Again, the issue of time and time spent within communities, time spent with people, building that rapport, building relationships. Again, knowing people in the community, building those relationships, making it a whole lot easier to plan and implement activities. Acceptance in the community, word of mouth, information being shared. And all of these are that building rapport, building connection kind of links. Having a larger community impact, so not just a small focus of the group in the community, but having a larger footprint, I guess, of the program within community. Using local champions, ambassadors, using elders in that kind of role of champion ambassadors, knowing the people, knowing the language, cultural sensitivity coming out again, having local people employed. And sends back to those kind of challenges, so recruitment and retention of local men and women within the programs. Now, I think there's just one more that's come through. So yeah, local role models and champions. Again, for the next part, I think it is the last part, so won't keep you too much longer before we get Tom to wrap up the day. So taking some of those strengths that you guys just identified, yeah, where would you rank those in terms of priorities or things that make or break a program, the strengths of a program, or your engagement with communities, the activities that you're doing? There's quite a few there, so now it's everyone kicking in their responses. So culture fit, kind of a really strong standout in the strengths. Making those community connections, having role models, ambassadors, elders within the community. Employing locals within the program, all strong standout strengths.
It's interesting, isn't it, Ben? The same as yesterday. There are some there are some challenges that are also strengths.
Yeah.
So I think that says a lot about all of you teams and your ability to respond to challenges.
Okay, I think that's probably the end of the polling, and I guess, yeah, things are quite some strong strengths coming out, or items there being identified. Like I said, these will all be shared, the kind of presentation with these questions and the items that you guys have identified. I think the idea is from this is kind of supporting the work that we do with teams and how we can, as the MVP it is, best support you guys and work alongside you guys with supporting these development of these strengths, the kind of challenges that are out there where we can support teams around those challenges is all where we want to be able to capture this information and work towards. Penny, your thoughts around kind of the next steps from this information?
Yeah, so I think look, this is really an ongoing conversation, isn't it? It's one we started a couple of years ago when we had our big conference in Alice Springs. And I think it's really important we keep this conversation going in around where the challenges are, what the gaps are, and also where you think we can best support you. So I think the next step is, as Ben says, we will put all this together and everything that we've learned from the workshop into a report. And then that's another springboard, if you like, to keep those conversations going with you and just do have some more discussions around what it is we can best do to help you move things forward.
Yeah, I think
sorry, I was just going to say that can happen in lots of ways, and it might be that what we do is have some more smaller Zoom conversations, for example, to try and pick some of this stuff apart.
Yep.
But sorry, Ben. No,
I was just going to kind of wrap up. I know it's getting late for some of those teams in the eastern states. So I think that is the last slide, I believe, for the poll. Thank you all for staying around to be part of that exercise. And now